Today, we'll unpack the history of Canada's role in global HIV/AIDS efforts, analyze the mechanics of these funding cuts, hear from stakeholders across the spectrum from Health Canada to local doctors in New Brunswick, and explore what this means for the future. We'll also look at how other countries, like South Africa, are stepping up and what Canada can learn. And malaria, a partnership pooling resources from G7 nations to support low- and middle-income countries. Canada pledged $1.21 billion for 2023 to 2025, a 30% increase from prior years, but dwarfed by the US's $8 billion commitment. The U.S. also launched PEPFAR in 2003 under President George W. Bush, a program credited with saving 26 million lives by providing HIV treatment to 20 million people across 54 countries. PEPFAR funded 70% of the global AIDS response, making it the backbone of international efforts. Stick with us, because this is a story of hope, urgency, and the power of collective action. Let's get started. To understand the gravity of Trump's funding cuts, we need to rewind and trace the history of the global fight against HIV/AIDS, a battle Canada has been part of for decades. HIV/AIDS emerged in the early 1980s, a terrifying epidemic that claimed millions of lives. By the 1990s, it was a global crisis, with sub-Saharan Africa hit hardest. In Canada, cities like Vancouver and Toronto saw devastating losses, particularly in marginalized communities. This spurred Canadian research, a multi-drug cocktail that transformed HIV from a death sentence to a manageable condition. Montaner's work at the BC Centre for Excellence in HIV/AIDS helped shape the UN's 909090 targets. By 2020, 90% of people living with HIV should know their status. 90% of those diagnosed should receive treatment, and 90% of those treated should achieve viral suppression. Canada's contributions didn't stop at research. In 2002, Canada co-founded the Global Fund to fight AIDS, tuberculosis,